Hi guys, this is Lee at Custom Hearing Solutions in Omaha and Lincoln, Nebraska. Wanted to do a video today talking about the causes of hearing loss. Everybody thinks they have enough information about the causes of hearing loss, and there are some very common causes that most people do know. Those are loud noises, the rock concerts, and things like that, as well as age. Those two things do certainly cause hearing loss. But there's some other causes of hearing loss that we really want to focus on here today. The more uncommon causes of hearing loss, the first one I want to talk about is cancer treatment. So most people realize that cancer treatments are not fun. They're very hard on our bodies and they're tough to go through. Obviously, we have to do those things. The consequences of not doing them can sometimes be dire. So when we talk about cancer treatments, almost to a rule, if somebody's went through chemotherapy or radiation, they are going to have some amount of hearing loss. So it's really important to know that as you're starting this process of going through cancer treatments and things like that, if you can, get in and have a hearing test done before you start those treatments. And then every 2 or 3 weeks, if you're going through some very aggressive treatment, come in and have your hearing tested as well. At the very least, definitely have your hearing tested if you've been through either chemotherapy or radiation, because it doesn't matter what causes that type of hearing loss. It's going to be a permanent hearing loss. So again, almost to a rule, if somebody's been through chemotherapy or radiation, there's going to be some amount of hearing loss there. And we want to see if there's something we can do to help you out. The next one I want to talk about is diabetes. Diabetes is very, very hard on all the different parts of our body. So the ear is the most highly vascularized part of our body, that inner ear inside there. So anything that affects our blood flow, even things as simple as dehydration can be hard on our hearing. So folks who have diabetes, their hearing loss can progress at a rate of 2 to 3 times faster than somebody who does not have diabetes. So again, if you're diabetic, be paying attention to those ears. Always a good idea in some spare time to get in and have your hearing tested so you know where you're at today. So in 2 or 3 years from now, when you do start to notice some changes, we can see how big those changes were for you. Another one is heart attacks and strokes. So again, the ear is very highly vascularized. So anytime we have any big changes with our blood, it could be as simple as high blood pressure or low blood pressure. But strokes and heart attacks are very, very common to cause hearing loss. In fact, a lot of cardiology offices are putting audiologists in their office because they want to make sure they catch those things. So if you've had a heart attack or you've had a stroke, make sure to get in and have a hearing test and see if there is any damage. And then the last one I want to talk about are antibiotics, and specifically very high doses of antibiotics. There are a lot of drugs out there that are considered ototoxic medications, and antibiotics in a very high dose are some of those drugs. So if you're on a high dose of antibiotics and you're noticing some changes with your hearing, make sure you get in and have it tested, so that way we can work with your physician and try to find an alternative drug. Because again, it doesn't matter what causes that hearing loss, it's going to be permanent. Even if we change the drug, you're still going to have the hearing loss that was already caused. Another good drug class would be antidepressants, very, very ototoxic. So we love to have them. We think they're great drugs to have out there to assist people in having a good quality of life, but you have to be aware of the consequences. And a lot of times you can be moved to an alternative drug that gets you the same result but doesn't affect your ear. So those are some of the common and uncommon causes of hearing loss out there. So, if you're having any of those things happen, make sure to get in here and have a hearing test, and we're happy to do that for you at no charge. Give us a call at 402-515-9028. Thanks. Have a great day.